So if you have a lumpectomy on your breast, there is a small incision. So it's about 2 or 3 centimeters, depending on the size of the lump and its location within the breast. Sometimes it's a line and sometimes it's a curved scar. And usually it's just a mild scar that's left, especially if it's healed well. If you have a mastectomy, on the other hand, that is a large scar which covers the entirety of the breast. So if you're having a mastectomy without any reconstruction, you'll be left with a large scar, normally from where your underarms would be all the way to the chest, middle of the chest bone. If you're having reconstruction, and depending on the type of reconstruction, you may get an implant or you may get a flap from another part of your body. So it does depend on what your reconstructive surgery is. So changes in the body, of course, impact our self-esteem, it impacts our mood, it impacts our overall well-being and how we interact with others and get on with our day-to-day living. So that is why it's important that not only do we feel good, but we like the way that we look in the mirror and how we present ourselves, because that's how we see ourselves as the person that we are. So that's why if you do have concerns about your skin or your hair or your overall health from a aesthetic point of view, it's important to have a chat with the doctor, because there are always things that we can do or encourage or recommend that might get you on the right path to get to where you want to be. So the aesthetic outcome after breast reconstruction, it depends on the reason why you're having the breast reconstruction. If it is for purely for aesthetic reasons, or if it is for treatment of a breast disease or breast cancer. And then depending on the reason, it depends on the outcome, because the surgeries are very different and it depends on the reason and what their expectations are. So it depends, and you need to discuss it with your breast surgeon so you get the best advice. So when you're having breast cancer treatment, depending on where you are in the journey, if you're going to have chemotherapy first or radiotherapy at the end, there is a portion which needs to have surgery. And depending on the surgery that is required, if it's a small lumpectomy, removing just the cancer itself and leaving the breast tissue normally alone, or if it's to remove the whole breast tissue, or if it's to remove both, if we think you're at higher risk of having breast cancer in both breasts, then it depends on the aesthetic outcome. So normally your breast surgeon will talk you through all the options, and you'll have a plastic surgeon that can also talk about the options available from a plastic surgery point of view. Sometimes this can be really overwhelming and you can find it hard to make the right decision for you. So when you find there's a lot of information, it's always good to come back to your GP, have a chat about what the options are, what feels right to you on a personal level, and then we can help guide you through that process.